name is Diana Gordon, and I'm a licensed midwife serving the southern Utah area, and I would love for you to cherish your birth. And today I'm here to talk to you about home birth midwifery in Utah. Now, home birth midwives are legally allowed to attend home births in Utah, and that is a wonderful thing. That gives so many families the opportunity to birth in their own home, in their own environment, and to choose the midwife that is the best fit for them. Now, licensure in the state of Utah is optional, which is also a wonderful thing. It allows couples and families to choose the exact midwife that they need to serve their individual needs. Now, during this talk today, it should take about 5 minutes, I'm going to cover the 4 different types of midwives that serve the Utah area. So the first type is the traditional midwife, also known as direct entry or lay midwife. Now, a direct entry, or I'm just going to refer to her as a traditional midwife because I prefer that term, is a midwife who has learned through apprenticeship. She trained underneath a midwife who had a large amount of experience in order to get the hands-on experience that she needed in order to competently and safely care for mothers and babies. Now, this takes anywhere from 2 to 10 years on average. And during that time, the midwife student also studies greatly, in depth, all of the midwifery information that she needs to know and that she needs to retain in order to be a good midwife. Now, some people choose a self-study method, which means they may go into books, they may attend lectures, they may attend classes such as CPR, neonatal resuscitation, classes on suturing, and as well as take college courses, while other midwives want a more formal education. So they attend a midwifery school, whether that is in person or distance. There are many different options. Now, the benefit of a licensed midwife is that she gets to choose her own clientele. She has no restrictions placed upon her about the type of clients that she is allowed to legally serve. So that means besides serving her very low-risk population of people who choose to birth at home, she also can work with special circumstances, such as those who are birthing twins that want to have babies at home, or a mother who's carrying a breech baby, a bottom-first baby who wants to birth at home, or mothers who have had multiple C-sections. It gives a lot of different options so that parents can choose what they feel is right for their care. Now, the trade-off that comes with being a traditional midwife in the state of Utah is that you're legally not allowed to carry any types of medications. So you're not allowed to carry Pitocin in case of hemorrhage after the birth. You're not allowed to carry lidocaine in case you need to perform sutures or similar medications like that. Now, the second type of midwife I'm going to cover is a certified professional midwife, or a CPM. A CPM is a traditional midwife who trained through apprenticeship and then self-study or attending midwifery school. And after she has completed that, she decided to take it a little bit further and to apply to become a certified professional midwife. And to do this, she needed to compile proof of how many births that she has attended, a certain required number, prove that she apprenticed for a set amount of time, have letters of references from past clients and other midwives that she's worked with, and prove that she's mastered certain skills in midwifery, as well as taking neonatal resuscitation and CPR. And if she has done all of these things and decides she can apply to sit for the NARM exam. The NARM exam is offered by the North American Registry of Midwives, and it's an 8-hour exam, including both a skills portion and a written exam, that's offered 3 times a year throughout the United States. And if the midwife passes that exam, she is given the title of a certified professional midwife. Now, in some states, in order to license or in order to practice legally, you need to be a certified professional midwife. Now, as a CPM in the state of Utah, it's a little bit easier to get reimbursed for insurance purposes for a couple who wants to have a home birth and wants to try to get insurance to pay for it than it is for a traditional midwife because of that certification. The third type of midwife is a licensed direct entry midwife. Now, a licensed direct entry midwife is a traditional midwife, learned through apprenticeship in school or self-study, and then she continued on to become a certified professional midwife. And after she got that credential, she took a few additional courses, including those such as pharmacology or fetal monitoring, and then she submits paperwork and applies to become licensed with the state. And if that's approved, she becomes a licensed midwife. Now, as a licensed midwife, she's legally allowed to carry certain medications, such as Pitocin in case of hemorrhage after birth, or lidocaine so that she can suture in case mom has a little tear, as well as, depending on her own personal circumstances, she may be legally allowed to administer IVs, antibiotics during labor, or other types of medication. It just depends on her circumstances. Now, the counteraction of being licensed is that there are some limitations on the types of clients that she can take. For example, she's not allowed to attend a mother who's carrying twins. She cannot attend a planned breech birth delivery, a bottom first delivery, and she cannot attend a mother who has had more than 2. So if mother's had 2 C-sections, that's okay. If she's had 3, that's not okay, as well as a few other restrictions. Now, the fourth type of midwife, back to licensed midwifery real quick. A licensed midwife will be slightly easier to bill for insurance than a CPM, just for a little bit of a comparison because of that licensure. Now, the fourth type of midwife is a certified nurse midwife. And the certified nurse midwife was first a nurse, and then she went on to school to get a master's degree in midwifery. Now, the main thing that is negative about a certified nurse midwife is that she is under the jurisdiction of her insurance and her backup doctor regarding the type of clients that she can take. And for this reason, the majority of certified nurse midwives practice in hospitals and do not attend home births. I believe nationwide it's about a 5% rate of CNMs that attend home births, but I'm not completely positive on that. And Utah is no different. There are not very many certified nurse midwives who choose to attend home births in Utah. But the benefits that come with a certified nurse midwife are that she can legally prescribe certain medications, such as birth control pills or antibiotics if you have a urinary tract infection during labor. But she is under those restrictions. So there are basically those 4 different types. And regardless of what type you choose, many of them are competent, wonderful midwives who have served thousands of families with wonderful results. I encourage all of you to interview different types of midwives to find out which one is best for you, to see that if it fits your ideas about births and your values. And I hope that you'll remember the 4 different types, which are the traditional, the direct entry or the lay midwife, the certified professional midwife, the licensed direct entry midwife, and the certified nurse midwife. If you have any more questions, I would be happy to answer them. You can contact me at completebeginnings.com. Thank you, and have a wonderful day.